Hello and welcome. In this final section of the VFC training series, we will be discussing how to prepare for vaccine administration. Before administering a vaccination, it is important to review the patient's immunization history. Use NYSVFC first to review their immunization history. However, if incomplete, you can also view the patient's record at your practice and/or written documentation from the patient if they received vaccination from another provider who has not entered the information into NYSVFC. Reviewing the patient's immunization history helps to assess which vaccines are needed for the visit and can help to avoid a missed opportunity to vaccinate. Review can also prevent vaccine administration errors such as giving a vaccine before the recommended minimum time interval. Utilize the most current ACIP immunization schedule to determine recommended vaccinations. It is also important to screen for contraindications and precautions before every dose of vaccine to prevent adverse events following vaccination. Patients and/or their caregivers may have questions or concerns around immunizations. This does not necessarily mean they don't want a vaccine, rather they are seeking information. Be prepared to share trusted information with them, as you as a healthcare provider are seen as one of the most trusted sources of information about vaccines. Lastly, be sure to have vaccine information statements or VISs ready to distribute to the patient for each vaccine you will be administering. As covered previously, it is federal law to give the patient and/or their guardian this information prior to vaccinating. Vaccine preparation is the final step in the cold chain before administration. Handling vaccines with care is equally as important as storing them properly. Prepare vaccines in a designated area away from any space where potentially contaminated items are placed. Only prepare vaccines when you are ready to administer them. Before preparing the vaccine, always check the vial to ensure it is the correct vaccine, and the expiration date or beyond use date to ensure it has not passed. Only administer vaccines you have prepared. This is a quality control and patient safety issue and a best practice standard of medication administration. In terms of equipment selection, always use a new, separate needle and syringe for each injection. Some syringes and needles are packaged with an expiration date, so be sure to consider this when selecting and ordering injection supplies. Never use expired equipment. Never administer vaccines from the same syringe to more than one patient, even if the needle has been changed. Each VFC provider should keep a supply of varying lengths of needles and syringes that are appropriate for the patient population they serve. Needle selection should be determined by the prescribed route, the weight of the individual being vaccinated, and the injection technique. This is to ensure that the vaccine is placed in the correct anatomical location for best efficacy. A 22 to 25 fine gauge needle can usually be used for administering vaccines. Additional information and training on needle selection, administration routes, and injection techniques can be found in separate clinical trainings on vaccine administration. See the resources document provided with these trainings for further information. The expiration date on each diluent and vaccine vial should always be checked before preparing vaccine for administration. If the expiration date includes only a month and year, use through the last day of the month, unless otherwise stated. If the expiration date includes a day with the month and year, the product may be used through the end of that day. Never administer expired vaccines. If expired vaccine is administered accidentally, contact the New York State VFC program right away. Some vaccines must be used prior to the expiration date that is printed on the label. This is referred to as the beyond use date or BUD. Vaccines with a BUD usually have a shorter expiration date that begins after the time the vial is opened or reconstituted. For example, for some multi-dose vials, there may be a specific period of use once they have been punctured, or may have a specific number of doses that can be withdrawn. The beyond use date should be noted on the label, along with the initials of the person who calculated it. Visit the YouTube link on this slide for more information on distinguishing the difference between a vaccine expiration date and beyond use date. Verify that the vaccine has been stored within the proper temperature range. If a temperature excursion is noted, do not administer and contact Vaccine Temp Excursion at health.ny.gov immediately. Vaccine and diluent vials should also be closely checked for damage or contamination prior to use. If damage, particulate matter, or contamination is suspected, do not use and contact the vaccine manufacturer for guidance. Visit the resources document included with these trainings for more information. Some vaccines are supplied in a lyophilized or freeze-dried form that requires it to be mixed with a liquid diluent. This can come in powder or pellet form and must be mixed with a diluent prior to administration. This process is known as reconstitution. Each diluent is specific to the corresponding vaccine and can vary in attributes such as volume, sterility, pH, and chemical balance. Some diluents contain antigen for a specific vaccine. Vaccines and diluents are not interchangeable, unless specified by the manufacturer. Never freeze diluents. If vaccine must be reconstituted, use only the diluent supplied for that vaccine. Never use a stock vial of sterile water or normal saline to reconstitute vaccines, and never administer vaccine reconstituted with the wrong diluent. If the vaccine is administered accidentally with the wrong diluent, contact the New York State VFC program for guidance regarding revaccination. This slide outlines the steps for reconstituting vaccine with a diluent. Reconstitute vaccines according to the manufacturer's guidelines just before administration. As mentioned previously, use only the manufacturer's supplied diluent for that vaccine. Use aseptic technique by removing the cap that protects the vial, and then swabbing the vial top with a sterile prepackaged alcohol pad and allow to dry. Inject all the diluent into the vaccine vial and agitate the vial to ensure thorough mixing. Consult the specific mixing instructions provided in the product information. After reconstitution, inspect the vaccine for discoloration or cloudiness. If it appears cloudy or discolored, do not continue to use the vaccine and contact the manufacturer for guidance. Use all the diluent supplied for a single dose and then draw up all of the vaccine after it is thoroughly reconstituted. Unless a needle gets contaminated or damaged, it's not necessary to change needles between drawing vaccine from the vial and administering the vaccine. Follow the links on this slide for resources related to reconstitution and using diluents. Follow standard medication preparation guidelines when drawing a dose of vaccine into a syringe. Do not draw the vaccine dose into a syringe until it is ready to be administered. Agitate the vaccine vial to mix vaccine thoroughly and obtain uniform suspension prior to withdrawing vaccine. Inspect vaccine for discoloration or particles that can't be resuspended. If problems are noted, the vaccine should not be administered. The cap on a vaccine vial functions as a dust cover. Once removed, cleanse the exposed rubber stopper with a sterile alcohol wipe and allow to dry completely before withdrawing the vaccine. For multi-dose vials, cleanse the rubber stopper each time prior to withdrawing a dose. When filling a syringe, never mix different vaccine products into the same syringe. Never combine partial doses from separate vials. Never enter a vial with a previously used syringe or needle. And never transfer vaccine from one syringe to another. Single-dose vials are designed for one-time use only, as they do not typically contain a bacteriostatic agent to preserve the vaccine after opening. Do not save leftover vaccine from these vials. Harmful bacteria can grow and infect a patient. Single-dose vials should never be used for more than one patient. Do not open a single-dose vial until the vial is ready to use. Once the protective cap has been removed, the vaccine should be used because it is not possible to tell if the rubber seal has been entered or punctured by a needle. Check the vial label before removing the cap on the vial to ensure the correct vaccine has been selected. Unused single-dose vials without a protective cap should be discarded at the end of the workday and reported as waste in NYSVFC. See separate trainings on vaccine returns and wastage for more information. A multi-dose vaccine vial is a vial of liquid medication that contains more than one dose of vaccine. Here are safety steps to remember when working with multi-dose vaccines. Multi-dose vials can be used more than once when aseptic technique is followed to draw up multiple doses because they do contain a bacteriostatic or preservative agent. You will still need to use a new sterile needle or syringe each time vaccine is drawn from a multi-dose vial. Multi-dose vials that will be used for more than one patient should not be kept or accessed in the immediate patient treatment area to prevent inadvertent contamination. For the same reason, any multi-dose vial brought into the immediate patient treatment area should be discarded after use. You should indicate that you have withdrawn a dose by making a tally mark on the outside of the multi-dose vial. This is a good way to tell how many doses are left. The Joint Commission multi-dose vials 28-day rule does not apply to vaccine vials, as it does for other multi-dose medication vials in the healthcare setting. Visit the resources document included with this training for a link which confirms this information. For some vaccines, multi-dose vials can be used until the expiration date printed on the vial. For example, inactivated polio vaccine, or IPOL, in a multi-dose vial can be used through the printed expiration date on the vial. On the other hand, for some vaccines, once the multi-dose vial has been entered or the rubber stopper has been punctured, the vaccine must be used within a certain number of days, known as the beyond use date or BUD. The beyond use date is the date or time after which a vaccine should not be used. Beyond use dates always occur prior to the printed expiration date on the vial by the manufacturer, never after. For example, for some inactivated influenza vaccine, once the stopper of the vial has been pierced, the vial must be discarded within 28 days. When handling multi-dose vials with beyond use dates, calculate the beyond use date using the time interval found in the vaccine's package insert. Label the vaccine with the date the vaccine was opened, the correct beyond use date, and your initials. As a reminder, never use any vial that has been contaminated or compromised in any way. Regarding COVID-19 vaccines, be careful to follow current guidance from the manufacturer and CDC for how long a multi-dose vial of COVID-19 may be used after puncturing the vial. The COVID-19 vaccine multi-dose vials do not contain preservatives and must be used within hours. Specific times vary by product. Always refer to the package insert for specific information. CDC recommends that providers draw up vaccines only at the time of administration, and that providers do not pre-draw vaccines. As mentioned in previous slides, vaccines should be prepared just prior to administration. Once vaccines are inside syringes, it is difficult to tell them apart. This can lead to administration errors. Pre-drawn vaccines that are not used must be discarded by the end of the workday, leading to unnecessary and avoidable vaccine waste. Most syringes are designed for immediate administration, not for storage. Bacterial contamination and growth can occur in syringes with pre-drawn vaccine that does not contain bacteriostatic agents. Also, vaccine components may interact with polymers in plastic syringes over time, which can potentially reduce vaccine viability, making the vaccine ineffective. To reiterate, vaccine manufacturers do not recommend that vaccines be pre-drawn in advance of vaccination clinics. This is due to many reasons as mentioned on the previous slide. As an alternative to pre-drawing vaccines, CDC recommends using manufacturer-filled syringes if possible for large immunization clinics. However, if vaccine must be pre-drawn, use the following guidance. At the end of the workday, any remaining vaccine in pre-drawn syringes should be discarded. If more than one vaccine type is to be administered, separate administration stations to be set up for each vaccine type to prevent medication errors. Vaccine should not be drawn up prior to arriving at the clinic site. Drawing up doses of vaccine hours or even days before a clinic is not acceptable. At the clinic site, no more than one multi-dose vial or 10 doses should be drawn up at one time by each vaccinator. Patient flow should be monitored to avoid drawing up unnecessary doses. Vaccinators should administer whichever doses they have pre-drawn before drawing up more doses to avoid vaccine wastage. Now we will summarize some of the do's and don'ts of vaccine preparation. Use a separate needle and syringe for each vaccine injection. Base needle selection on the prescribed route of the vaccine, the size of the individual, and the injection technique being used. Don't reuse syringes or needles. Check the expiration dates on needles and syringes, as some are packaged with an expiration date. Inspect vaccine and diluent vials for damage or contamination, and always check expiration and beyond use dates. The cap on top of a vaccine vial functions as a dust cover. Once removed, clean the exposed rubber stopper with a prepackaged sterile alcohol wipe. Never administer expired, damaged, discolored, or contaminated vaccine or diluent. If reconstitution is needed, do not use sterile water or saline. Only use the manufacturer-supplied diluent. Agitate the vial to mix the reconstituted vaccine thoroughly and obtain a uniform suspension prior to withdrawing each dose. Inspect the vaccine visually for discoloration, precipitation, or if it cannot be resuspended prior to administration. If problems are noted such as discoloration or cloudiness, do not administer the vaccine. Use single-dose vials and manufacturer-filled syringes appropriately as single-dose administration. Discard single-dose vials with dust covers removed and/or manufacturer-filled syringes at the end of each workday. Don't combine multiple vaccines into one syringe. Vaccines should never be combined in a single syringe except when specifically approved by the U.S. Food and Drug Administration or FDA and packaged for that specific purpose. Most combination vaccines will be pre-combined by the manufacturer. Don't transfer vaccine from one syringe to another. Partial doses from separate vials should not be combined to obtain a full dose. As with transferring vaccine from one syringe to another, this can increase the risk of contamination. CDC recommends that providers draw up vaccines only at the time of administration and administer doses as soon as possible after filling. Don't administer a vaccine that someone else has prepared and drawn up. If vaccine is drawn up by one person and administered by a different person, the person administering the vaccine cannot be sure about what is in the syringe and its sterility. Thank you for your participation in this training on vaccine preparation. As always, questions can be sent to NYVFC@health.ny.gov.